Hi, I'm Trish, I'm the podiatrist.
And I'm Genevieve, a physiotherapist.
So today, for the day, we'll be travelling to the Pepper Mennardi Medical Clinic and we'll be providing services that aren't available in isolated areas.
It's so great to be based in Darwin where you've got everything that you need and then still be able to fly out to a remote community and experience being able to provide a service where people are really appreciative of it. One thing I really love about working in remote communities is that every community is so different. So we're going to go into town to the clinic.
When I first came here, I didn't have any expectations. My goal was to help people in isolated areas that didn't have access to foot care. It's been eye-opening, both in the foot care and cultural. It's very culturally enlightening as well.
Working in the remote communities, you get opportunities that you wouldn't get in the major cities, in the major hospitals, so you can come across some things that you wouldn't normally see. I love coming out to this community, Pepper Mennardi. Everyone's so friendly and appreciative of the service, and it's really special to build relationships with them. High as you can go. I love the diversity of the work. I get to develop quite a range of skills in all different areas of physio. You overlap with people, so it means you have lots of multidisciplinary input, and the whole team out in the health centres are really supportive of each other. We have a focus of chronic disease. That's a really big issue out in community. However, you get a range of everything from back pain to shoulders, sports injuries. It's definitely not just about the work. I love building relationships with people and really immersing in their culture and learning about that. And then after a while, building those relationships, you really get accepted into the family, and it's a really special feeling to go out there and be welcomed like that.
I like to work here because I have a variety of caseloads. Every day is a different day, and the challenges that you get here are different to where you would work in a city because the resources are different. You have to learn to think outside the box. There is a really good saying where we can't change the beginning, but we can start to change the ending. What's really good in the remote areas is that we're providing education to prevent amputations. So that's my priority. So communication is key, so building relationships with the patients. It's a very good experience because they're getting an understanding, and I'm now getting family members, their family members coming in to get foot care. It's good to see a smile on their faces when they leave, and it's good to see that they recognise me when I come to the town and they know that I'm the podiatrist. I love it. It's not something that you'll ever read in a textbook.
So I'm based here in Darwin, and I probably do a remote trip every couple of weeks. Darwin's a nice relaxed lifestyle. You definitely don't have to rush it anywhere. Everyone's on a bit of slow time. The weather's great. There's the dry season for half the year, which is amazing weather to go out camping, and then the build up, and then you've got these spectacular storms during the wet season. I love the outdoors, so I love getting away and camping and hiking on the weekends. I love getting up early and go around East Point, and you've got a beautiful lake there, and pretty much have the place to yourself half the time. Anywhere you go, you're probably going to know about 10 or so people there, and if you don't, you'll have 10 or so new friends by the time you leave that spot.
So the lifestyle in Darwin is very relaxing. Everybody's friendly and fun, and it's very community focused. In Darwin, there's everything that you need. It has cafes, it has bars, large shopping centres. We're lucky in living in Darwin because travelling to Litchfield's not far. There's some beautiful refreshing water holes at Litchfield and great walking tracks. The wet season, the landscape was green and amazing. Lots of wetlands, beautiful rivers. The dry season, the landscape has changed so differently. So it's very unique to see.
I think it's very unique up here to be able to have everything that you need living in Darwin and then go out to the remote communities. There's nowhere else really that I've found that I can do that. The fact that you get to be there and experience that culture and learn about it and then use that in therapy as well would be pretty special.
You broaden your scope of practice and you have to be open to other opinions and learn to work with what you have at the medical clinics. If I can change quality of life for one person, then that's worth everything that I've put into it.